when we do a clinical examination on a dog? Well, first of all, we take a look at the overall dog and we greet it in the consultation. We're looking for overall body size and shape. Bess here's got a little bit of spare skin, so she's a little bit overweight, but her coat's nice and glossy and she's bright and alert. Then we take a look at the head. We're looking for symmetry with the eyes, the ears, the face itself. Check inside the ears, just for any wax build-up or smells or any redness. Take a look at the eyes, just make sure there's no inflammation. Dogs and cats have a third eyelid, so if we depress the eye we can see the third eyelid come along and make sure there's no disease of that. We look at the nose for any discharge. A wet nose or a dry nose doesn't actually mean a dog is well or unwell, but we always check to make sure it looks healthy. Then we check the teeth. We're looking for any tartar or breakage. And we're also looking to see the gum colour. So Bess here is a nice pink colour. We blanch the gum with our finger and it refills within about a second. Then we're feeling for the lymph nodes. So there are lymph nodes and we're just making sure those are all small and symmetrical. If one or two of them are enlarged, it could mean a local infection. If they're all enlarged, it could mean a generalised infection or something a bit more sinister. Then we run our hands over the legs, feeling for any swellings of joints. Extending and flexing the limbs will highlight any areas of pain. Bessie's quite old, so she's a little bit arthritic, which is why she licked me then, because she didn't really like me picking up her front legs. So we run our hands all over her, checking for any lumps and bumps, under the tummy to see if there are any hernias, and between the back legs. Quite a lot of cats in particular will build up fat reserves here, so even though they may not look overweight, if we feel big fat pads here, it indicates that actually the animal is overweight and could do with a diet. Similarly on the back legs, we just run our hands over, again checking those lymph nodes, and again checking to make sure that there's comfort and no swelling of the joints when we move the legs. When we lift up the tail, make sure the bottom is fine, make sure there's no discharge from around the lady's parts. Then we come on to listening. So we listen to both sides of the chest. We're listening for a normal heart rate and rhythm. If a dog is panting, all you can hear is the panting noise, so quite often we'll just gently lift the head just to stop them panting. Check the lungs as well, just to make sure there's no increased noise or pops or crackles, which can indicate fluid build-up. And if a dog has been having breathing problems, we also sometimes listen under the throat to see if it's upper airway or lower airway disease. So when it looks like your vet is just stroking their dog whilst they're talking to you, they're actually picking up a huge amount of information about multiple organ systems. We also have a feel of the tummy, make sure it's comfortable. We should be able to pretty much meet our hands in the middle of the tummy in all sections. If there's any areas of discomfort or anything that feels hard or enlarged or abnormal, then that may indicate the need for further investigations.